Good morning. I'm glad you're still with us here on MorningATNTV. For those that are just joining us, welcome on board. It's good to have all hands on deck as we inch further into the day. I do hope the shower that was occasioned upon the city and its metropolitan areas 2 hours ago has eased and you're able to make it to office and for business across Kampala and its metropolitan area. Time now for a discussion on very pertinent matters of health, and in studio I'm joined by Dr. Kenneth Mugabe. Dr. Kenneth Mugabe is an obstetrician and gynecologist at Mbale Regional Referral Hospital, and he's here to talk to us about an upcoming conference, and this is the fourth, I must emphasize, National Safe Motherhood Conference that is scheduled for the 29th to the 31st of October 2024, is preceded by initial 3 weeks of a national campaign and awareness on safe motherhood and the pillars and efforts to reduce mortality from preventable causes, especially postpartum hemorrhage, which remains a leading cause of maternal mortality in Uganda. The theme of the conference is strengthening community engagement for sustainable maternal and child health. Let's now have the detail. A very warm welcome to MorningATNTV, Dr. Mugabe.
Thank you, thank you.
How are you doing?
I'm fine.
Great. The figures and the trends and the reports are not anything to write home about when it comes to maternal health and mortality across the country. And in light of the upcoming conference, safe motherhood should be a conversation that must be deepened.
Yes.
What does the conference intend to achieve specifically?
Yeah, thank you very much. Good morning, our viewers. The conference has 4 objectives. Of course, we talked about the theme of strengthening community engagement for sustainable maternal and newborn health. But it's going to anchor on 4 objectives. One of them is we want to disseminate good standards of practice and enable shared learning amongst the frontline health workers in Uganda and also leaders in the realm of safe motherhood. Secondly, we also want to give a platform, or this conference will give a platform for successful initiatives and community programs that have effectively strengthened community-based maternal and newborn health service delivery. Then thirdly, we will also intend to showcase innovative approaches, technologies and interventions that have potential to transform maternal and newborn health care delivery at community level. But lastly, and very importantly, we want to facilitate discussions around policy implications and advocacy, and try to see how a supportive policy environment can be created to enable sustainable investment within maternal and newborn health in our country.
Okay.
Yes.
And this is going to be happening on the 29th
this
to the 31st?
will be taking 3 days from Tuesday the 29th of October to Thursday the 31st of October.
Where?
That will be at Peak Resort Hotel Munyonyo. And we're expecting about 700 delegates from all over the world.
Okay.
Yes.
All right. That in terms of reducing maternal mortality by preventing postpartum hemorrhage, what is the progress report like, and what is the state of maternal and newborn health in the country?
Well, government has really done a lot of efforts to bring down maternal and newborn deaths in the country. About 8 years ago, we were losing about 438 mothers per 100,000 live births. But within now, it has reduced significantly by about 57% to 189 mothers dying per 100,000 live births. That's a significant reduction, and we want to applaud government for that. And not only has government made strides in reducing maternal deaths, but also reducing newborn deaths. 8 years ago, we were having about 27 newborns per 1,000 live births. Yeah. But now we have, it has reduced to 22 per 1,000. So these are great efforts by our government of Uganda, and we want to appreciate their efforts to reducing these deaths.
Within that, I am meant to understand there is a stagnation when it comes to mortality rate?
Yes, the newborn mortality rates have not reduced so much, but they have still gone down.
What is making that so grim?
Well, there are a number of factors, really. There are a number of factors. That's why we are trying to focus on the community as our key stakeholder. You know that the biggest cause of maternal deaths right now is hemorrhage, bleeding, excessive bleeding after birth, followed by hypertension in pregnancy, and then infections. But for the newborns, what is basically happening is that most of these mothers come to us when the babies, when they're advanced in labor, the babies are tired, they are delivered when they can't breathe well. That is the biggest cause, and usually the delays are in the community, you know.
The delays in seeking medical help and attention.
Yeah, the mother or the caretakers or the people at home deciding that, you know, perceiving that this mother needs to go to the hospital for care is a very big challenge. But also the distance from their homes to the health facilities in some areas are really long, and also in some areas the terrain is not forthcoming, it's not good enough, especially the hilly areas. You can give an example of our region, the Elgon region. I guess you've seen some of these pictures. So these are some of the things that are causing these deaths to stagnate, but government is committed to reducing these deaths despite stagnation.
Okay, no doubt, commendable efforts that are being undertaken across board, of course, in ensuring that some of these very avoidable cases of death and mortality can be written back. Tell us about the antenatal care and what it does to the overall picture of reducing maternal mortality. What are the benefits of ANC attendance?
Yes, thank you very much. Yeah, antenatal care is very, very important. From our data from the UDHS, Uganda Demographic and Health Survey, currently, we have about 72% of our mothers who are pregnant attending all the 4 visits of antenatal. We know that the recommended visits are 8. That comes to at least 1 visit per month. But we are urging all our pregnant mothers to come and attend antenatal because, and starting early in the first 12 weeks, it's very important that you start early in the first 3 months. And the benefits are such that when you come early, we are able to plan together what's called the birth plan. Because most of these mothers can be high risk. They have complications from their previous pregnancies or from their general well-being that makes them, puts them at high risk of having complications during pregnancy or after delivery. So when they come early, we are able to catch these risks early and plan better.
That's right.
As key stakeholders in these pregnancies, you know. So we are urging our communities that health workers are key stakeholders in when you get pregnant, and when you come early, we plan better. And the other things that can happen in antenatal is we also screen for these risk factors like anemia in pregnancy, when mothers, you know, don't have enough blood, malaria in pregnancy, And, you know, these are the things that predispose these mothers to bleed excessively, which is the biggest killer. So we screen them, and also we put in place interventions that prevent these complications, like we give them iron tablets. We screen for malaria. You know, malaria can cause anemia, you know. We also give them drugs that are dewormers, you know, worms can cause iron deficiency. So there are interventions that we put in place during antenatal that prevent most of these risks during pregnancy.
Allow me to stay on that very briefly before we can transition on birth preparedness at individual level. This one, of course, cuts across from the mother to the immediate family, how she prepares for that. Depression and malnutrition have been cited in a report that the conference organizers shared as one that, if easily detected in the early stages of antenatal care, can, of course, ensure that the mother delivers very successfully. But take us through the extent of depression among women in Uganda. The reason I'm saying this is that the statistics indicate that many people are stressed, and this stress cuts across, so pregnant mothers too, within our communities. And when you are depressed and you're grappling with a nutrition regime that might not be sufficient or acceptable, that creates a whole set of complications that could hinder safe delivery. Yeah, of course, depression usually comes into being, first of all, when our mothers have a short delivery to pregnancy interval and they have not recovered well from the effects of the previous pregnancy. Many of them, if the pregnancy comes too soon and they have not got over what happened in the previous pregnancy, especially when there were complications, they are bound to be depressed. The other issue is partner support. When they don't have adequate partner support throughout their pregnancy. Call them husbands. When you say partners, you might confuse people who are deciding to be alternative marriage.
Yeah, sometimes it could be it could be husbands. It could be any other caretaker, family members within the home. When they're not giving them adequate support, it causes them to have this depression that we are talking about. And of course, when they are depressed, they are less likely to come and seek for care. They are a bit withdrawn. They are not interested in coming to seek for care. So when they are not interested and they sit back and they have these risks within them, then they are bound to get complications during their pregnancies.
Okay. Yeah. Avoiding other complications by ensuring that you're sleeping under a mosquito net. This is pretty standard stuff that every mother is expected to do.
The malaria
taking all 3 doses of Fansida, preventing malaria.
Exactly, and I want to stress that preventing malaria is a long-hanging fruit for preventing complications
in pregnancy.
Yeah, you must take drugs like Fansida for preventing malaria during pregnancy, and this will start right away from the 13th week, and you take every month up to the time when you deliver. It's very, very important. Our viewers. Yes.
All right. So take us through what signs somebody can quickly see, for example, to identify dangers to the newborn that you can work quickly in order to mitigate the eventuality of death.
Yes, so immediately the baby is born, how you can tell that there could be a problem, is we expect the baby to cry immediately they are born, or soon after they are born.
If they don't, there's a problem.
If the baby is not crying, definitely there should be a problem. The baby should be playing and having some movements. And if you notice that the baby is floppy and not moving, not crying, definitely there should be a problem. The other thing is breastfeeding. The baby should be able to reach out for the breast within the next 35, within the next 35 to 1 hour. 35 means 1 hour. She would reach out to the brain naturally by itself. That's why immediately the baby is born, we put it on the mother's abdomen. We don't take it away from the mother.
That is right.
Yeah, and if this doesn't take place, then we know there is a problem. There are also other key things which you can notice at the time of delivery that could strike you. One of them is fevers, if the baby is hot at birth or in the immediate time after birth. If the baby has yellowing of the body, the eyes and that kind of thing, we call it jaundice. Jaundice, yeah. Then at birth, you know, immediate at birth. Sometimes it comes later on, no, but if it's immediate at birth, the day of delivery, then that's a problem. And then finally, if the baby convulses, sometimes it's very difficult to see these convulsions of the baby jerking. You know, sometimes it's very difficult to see them, but in case you see them, that also points to a baby who is not well and needs care. Okay. Yes.
Let's transition into the roles of different stakeholders, of course led by the Ministry of Health in supporting development partners, NGOs and the private sector to ensure that this whole spectre of mortality is reversed or managed. What should the Ministry of Health strengthen?
Well, just maybe in one sentence, the Ministry of Health should strengthen the skilling of health workers, make sure that they are trained well, they are skilled, they are knowledgeable in attending to these patients, and also creating an enabling environment for them to work. And of course, one of the biggest things that they have really also done so well is making sure that they functionalize most of these health centers closer to the communities that need this service, maternal and newborn care services.
Okay. Yes. Of course, ensuring when we see strikes going on, it of course does completely hammer any efforts to ensure that mortality is reduced. I do hope the President's plans to ensure that doctors who go into private practice don't return to the civil service. I don't know how to respond to that, but I think the medics are onto it. We shall be hearing very exclusively from you guys anytime from now. But health workers do also have a role to play in here. And of course, when I say health workers, somebody might say, what's the difference between the Minister of Health? Minister of Health rolls out health workers, but the health workers are the individual people,
the frontliners,
the front line, those are in the media we call them the foot soldiers.
The foot soldiers, yes.
So take us through exactly how they are very significant in this.
Yes, health workers are key stakeholders in reducing maternal and newborn health in terms of, first of all, offering an equitable service to the clients that come to us as foot soldiers. We make sure that we are receptible to these clients. We offer evidence-based interventions to these, and these interventions must be timely. You know, they must be very timely, and and of quality.
Of quality.
Yes.
Okay.
Yeah.
All right. I think it's important also, especially for the women in rural areas where these numbers that contribute to the mortality rate are really high. The traditional birth attendants, have they been integrated well into the system? Or there's always a controversy, and when the experts speak, the other ones are uncomfortable. When the other ones speak, the experts are uncomfortable. Has there been harmony and common ground?
It is a very sticky topic of traditional birth attendants, but as you are aware, our Uganda Demographic and Health Survey pointed out that 91% of our communities are actually delivering with us. And it's only 9% that are going to the traditional birth attendants, delivering at home. So government has really taken a lot of big effort to sensitize the communities about the plight of making sure that they come, when people are pregnant, they come and seek services from a qualified health personnel, come to the health facility for antenatal care and delivery. And the issue of traditional birth attendants is being addressed squarely by the,
the authorities and responsible officers.
And we are hoping that in the years that you know, that are coming, this 9% will be reduced to almost 0%.
All right, Dr. Magembe, we are coming to the close of the program. I just want you to again remind us about the conference and who will attend away from those that have been invited. Can the average Chris Higenyi attend this conference? So that I can understand how to deal with my wife and offer the best possible support, especially during pregnancy.
Yeah, yes, Chris, thank you very much once again. I would like to again welcome all of you to the 4th National Safe Motherhood Conference, which is slated for next week from Tuesday 29th of October to the Thursday 31st of October. And our target groups for this conference are majorly health workers, researchers, policymakers, advocates, and all our stakeholders. And the theme of the conference, Chris, is to strengthen community engagement for sustainable maternal and newborn health. Remember I said there was an improvement in the reduction of maternal and newborn health. Reduction. So we want to sustain that. The only way we can do that is to engage the community.
All right.
Yes.
Dr. Kenneth Mugabe, obstetrician and gynecologist at Mbale Regional Referral Hospital. You have the full support of Morning at NTV.
Thank you. Thank you.
You're most welcome.
Thank you.
Time now for a short break.